You can tell that you have.
Dr. Bill Adams strives to have a personal connection with his plastic surgery patients, and most of the time, it's no problem.
And I see patients all the time who goes, I feel like I already met you. I watched your videos and they have an idea what we talk about and our demeanor. And so that, I think, is a great way for people to initially just figure out, hey, can I connect with that person or not? We're going to bring in an expert, international expert.
In the digital era, Dr. Adams recommends a patient check out a doctor's online profile before the first visit to open the lines of communication. As the founder of the Plastic Surgery Channel, Dr. Adams shares a vast amount of his cutting-edge expertise online. That helps a patient know early on if he's the right fit.
You have to have that connection. You have to feel like that there's a real relationship between the doctor and the patient, and so patients really need to make sure that they're going to somebody that they feel like they connect with.
It's an important connection, but it doesn't always come easy. So we've created this checklist. We'll call it Dr. Adams Rules. Remember, do your homework. Know your doctor beforehand. And once you get that meeting, don't just sit and listen. Take some notes so you remember what the doctor said. And don't be shy during that meeting. Speak up. Ask some questions if you have it. Remember, the meeting shouldn't be stressful. Take a deep breath. There should be a connection between you and your doctor.
Doctors are intimidating to patients, even if they don't want to be. They're intimidating because they wear a long white coat, buttoned up, they're very professional looking, theoretically anyway. The patients look at them and they go, wow, that looks like somebody important, or that's like my dad, or that's like some other authority figure.
Dr. Jim Namnoon says it can be difficult for a woman to let her guard down and reveal not only her body, but her thoughts to a plastic surgeon for something as intimate as a breast augmentation.
1, 2, 3.
Dr. Namnoon says new advances like 3D imaging before the operation helps break the ice, allowing the patient to see her new shape before surgery, letting her feel comfortable with the doctor and more willing to open up and share what she is really looking for.
And when they trust me, they can start to tell me a little bit more about what they really want, because they know that I won't judge them. They know that I won't think less of them.
And above all, doctors say when a patient is choosing a plastic surgeon, look for one that shows he or she too can listen.
If I do all the talking, I kind of tell you blah, 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 but it's not what you want, you're never going to be happy. So you've got to listen to the patient. That's why that connection is important.
A connection that when it's right, you'll know it. It has to work both ways to feel like you're on the same team. For the Plastic Surgery Channel, I'm Tongish.